Hello everyone, Dr. John Halmaghi here with today's Headache and Facial Pain Institute. One of the most common questions and clinical dilemmas that we see with our patients centers around the orthotics, the mouthpieces, the bite splints, the retainers, whatever you want to call them. Most of our patients wonder why an old mouthpiece didn't work for their problem. What kind of mouthpiece do they need now to get rid of their pain? So, as every patient is different, so are the individual treatments that we propose for our patients. So maybe you've had a mouthpiece, a bite splint, a retainer, and you didn't see any improvement for your pain. Maybe things got worse. Why is this happening? There's a few things you have to understand. There are different mouthpieces for different purposes. So if a patient comes into our office and they clench severely or chronically, then there are particular mouthpieces that are designed just for that purpose. Some are very simple, such as a deprogrammer. Some can get a little bit more complicated, such as a retainer or double retainers if the patient has had orthodontics or if the teeth are shifting. So it's always important to address the clenching first, because in the majority of the patients that we see, it's the clenching and the grinding that leads to the chronic issues over time. So if a patient comes to our office and we diagnose them with a TMJ, an actual TMJ joint problem, that could change the recommendations that we make. However, we always start out with simple treatments for clenching and grinding. And those particular type of mouthpieces are usually simpler in design. So let's take, for example, an upper mouthpiece that goes on your upper jaw. Maybe you've had one because it is the most popular of all the mouthpieces that are fabricated by just about every dentist in our country. So if you've had an upper mouthpiece and it hasn't worked, you have to consider the following facts. Upper mouthpieces allow you to bite all of your teeth together, especially your back teeth. When you have that type of mouthpiece and all of your bottom teeth are touching into it, it actually can promote more clenching and cause more muscle stress and even make you clench more, because we don't want all of your teeth to touch into an appliance when you're a clencher. The only way to help with this type of a problem is to design mouthpieces that are smaller, more comfortable, and are focused on not allowing you to bite all of your teeth together. In most of these cases, we fabricate these mouthpieces so that they only allow you to touch your front teeth and not your back. And usually they have to be either very small or very thin in nature to be able to do that. Now, if you've had a lower mouthpiece and the dentist told you that this is going to solve your clenching and your bruxing problems, you're back in the same boat. It may be a different boat, but you're back in the same boat, because again, biting your back teeth together when you have a clenching problem and you have a mouthpiece that makes you do that, it does not work. So again, any mouthpiece that allows you to bite all of your teeth together, particularly your back teeth, usually they're not going to work for a clenching or a bruxing problem. The majority of the mouthpieces that are made to allow you to bite all of your teeth together are more specifically meant to stabilize your joint and allow the joint to heal. Now, upper mouthpieces for that purpose usually don't work to stabilize the joint. In only certain cases, or just a few number of cases that we see, will an upper mouthpiece actually stabilize your jaw and your joint. When you have a joint problem and you've been diagnosed with a joint problem, a cartilage wear or degeneration or sclerosis, and you've actually had that diagnosis, then only a lower mouthpiece that is specifically designed to retrain your jaws on how you chew and how you talk and how you sleep and how you swallow, only those type of mouthpieces can be used for the purpose of actually rehabilitating and allowing your jaw joint to heal. None of those mouthpieces are going to work for clenching and grinding. So if you've received one of these for that purpose and your dentist or specialty provider told you that this particular mouthpiece was made to help you clench, you're most likely not going to see any progress with that. So again, lower mouthpieces that are designed for you to bite all of your teeth into them. Number one, they have to have a very particular design. They have to reset your jaw in a very particular position. And they have to have a lab fabrication that is a little bit more complex. It basically becomes your second mouth. It becomes your artificial bite. And they are done for the purpose of not only retraining your jaws, but mainly for the purpose of healing the jaw joints and getting the jaw back in the right position. Most of them cannot be used until you're able to control the clenching. Sometimes you may need some physical therapy. You have to quiet down the muscle function first and foremost before you can even think of rehabilitating your jaw joints. The majority of our migraine patients, they usually have degenerated jaw joints, and they have a lot of damage to the cartilage in the joints. They also have clenching and bruxing problems and muscular problems and neck problems. So for these treatments, we follow a sort of a phase 1 or a phase 2 or phase 3 treatment where we have to do the clenching devices, we have to do some therapy, and then we have to consider doing a more advanced neuromuscular mouthpiece to help regenerate and decompress and heal the joints to get rid of all the symptoms, especially migraines and headaches. So again, everybody's different. Everybody has individual needs. At our office, we use anywhere from 3 to 7 different type of mouthpieces. It's based on the person's bite, their jaw position, their muscle function, and of course, their ability to be able to tolerate these things. And we do it slowly in steps. So if your mouthpiece is not working and you've possibly had 1, 2, sometimes we see people come into our office with 3 or 4 different mouthpieces, and out of those, most of the time you see that none of them really work and none of them are designed for the purpose and for the individual needs of that patient.